Okay, we're back again. I have Ashley Langford, Caitlin Whiteley, Mark Martire, all physical therapists, all very smart. And I'm Adam Goodrich, marketing guy at Cora. And Ashley has an important question to ask Caitlin and Mark, and we're going to sit back and listen to the reaction.
First off, don't be fooled. Adam's very smart also. So around vestibular, we mentioned just recently about like you're coming out of school. These can be patients that are kind of scary to treat. Likely you've had some type of education in school on it. From my experience, training, being in the clinic, I think we should bring up the topic of the value of pursuing continuing education after school for outpatient clinicians. What could you run into if you know the basics of treating, let's say, your BPPV, your inner ear, and if you don't know how to take it a step further, what could happen during treatment? Not to scare people, but to encourage them to fully invest and to learn everything they can in this field. What are your thoughts?
I totally agree. I don't think it's something that new clinicians should be scared of. But if I just even speak to my own kind of experience, prior to being a part of Cora, I was kind of voluntold into treating vestibular conditions. My CI had treated vestibular, and then another clinician that I had worked with had treated a little vestibular. So they said, "You got it, kid." But I didn't get a whole lot of additional training beyond the lab or two that I hadn't had in school and that experience I had had with those CIs. And so my basic stuff I could muddle my way through, but then I would sometimes hit a roadblock. So I didn't feel confident enough to go to doctors to be like, "Hey, look, I do this. Send those patients to me." But then once we were acquired by Quora and I was able to take some courses, I felt so much more confident to go that extra step to see those little bit more complicated conditions, to see those patients who didn't present quite textbook. And then I felt like the guru and the expert, and I could go out to those doctors and kind of make myself marketable and kind of have my own little niche within my clinic and within my region.
I think to piggyback that, like taking the live courses is second to none with this stuff. Being able to get your hands on the patient in hand placement, head positioning, body positioning, you just can't do that virtually. And I think that what we're seeing is a lot of younger clinicians had gone through the COVID era and they learned this virtually. And so they may never even had a live patient in front of them where they've seen a vestibular dysfunction or a balance issue. Or on the flip side, you see patients that had a total knee replacement or an orthopedic condition, and they mention in their history, "Oh, by the way, I wake up dizzy every morning." So maybe they're not coming in with a vestibular issue, but being able to have the knowledge to then assess it accurately, build that into your treatment plan, I think is hugely important.
Absolutely. There's from experience, the more you learn, the more you realize there's just more to offer and more to learn. But treating the crystals can sometimes just be the very beginning of it. For I'm going to say almost, but for almost every patient with vestibular issues, I'm going to be assessing and likely treating the neck. I'm also going to follow up with some type of exercise and standing and walking and balance. They don't necessarily need to be in the clinic for weeks and weeks. It could transition over to some type of home program, but there's usually small components because they don't just come in with one thing. And another side comment here is when treating BPPV and what can seem very simple, where you're positioning the head to get the crystals in place. Sometimes if you haven't had great training, and even if you have, sometimes they'll migrate into a canal that they'll end up more dizzy and likely nauseous than they were when they came in. Now, I don't say that to scare anyone out of it, but the treatment for that is actually easier than the treatment for the first one. But unless you went through the continuing education to know how to treat one canal versus another, you could end up in a position where the patient feels worse, and then you're calling your buddies and trying to figure out, Googling what do I need to do. So the treatments aren't scary or complicated, but you do want to invest, learn everything you can so that you can fully treat these individuals.
Or not treat these individuals. If you find something in your exam that is more of a central finding, but they're coming to you with a diagnosis of BPPV, I'm reminded I actually had a patient, this was probably 12 years ago at this point, but she came in with a diagnosis script of BPPV from her primary care physician. We go through the tests and measures, and the nystagmus that we were seeing, the bouncing of the eyes, just it wasn't making sense with the tests that we were putting her through. So we sent her back to the doctor, and turned out they found that she had MS, which was undiagnosed. And so
Wow.
she ended up coming back in and being super thankful that we put her through all that stuff.
Yes, and what a special experience. And I bet you would agree that the training itself wasn't that complicated to where it
Yeah.
stood out to you to say, hold on, this isn't right.
Right. Exactly.
Now, do you second guess yourself though, or you're like, wait a minute, there's something going on here. I need a second set of eyes. And you,
Absolutely. Yeah. I mean, I was fortunate enough to have somebody else in the clinic who was also trained in vestibular rehab. So I had him just come over and take a look, and he was like, I'm not comfortable with it. Let's at the very least be on the safe side and send them back or refer back or just make the phone call back to the doctor. And that's what we did. We actually called the doctor, and he said, send her back in. She'll come in tomorrow. We'll check her out. And that's when they found that.
that is so cool. I bet that doctor was grateful too. Not only the
He was
patient, but the
very,
doctor.
Yeah. And then we ended up getting a lot more vestibular patients out of it because he trusted us.
That's good marketing. There you go. Honesty is always the best policy. Wow. Okay. Ashley, did the answers satisfy the question? Are you good there?
I am good.
I
And I'm
enjoyed
very
that conversation.
appreciative.
I didn't have to be involved in it that much. All right. Any final words?
Yep.
That's
All right.
good.
Get educated. Get trained.
There you
Take
go.
the Con Ed course. All right. All right. Thank you, Ashley. Thank you, Caitlin. Thank you, Mark. That is it for this session.